Good morning and namaskar, dear students, fellow veterinarians and colleagues. Myself, Dr. Naresh Kumar Singh, Professor and Head of the Department of Veterinary Surgery and Radiology at Faculty of Veterinary and Animal Sciences, Banaras Hindu University. Today, we will talk about scope and uses of radiology. To know further into the details, let us know what is radiology. As the radiation science grew, we started to talk about radiology, which is also known as röntgenology, because it was first identified and discovered by the W.C. Röntgen, and hence the radiology is also being denoted as röntgenology. What is it? It is a branch of medical science which deals with diagnostic and therapeutic application of radiant energy. And what is a radiant energy? Radiant energy, or the radiant energy for this purpose, includes variety of radiations, that is X-rays, beta rays or gamma radiations. As such, radiology field can be divided into two broad areas, namely diagnostic radiology and interventional radiology. Diagnostic radiology, when we refer to, it means whatever the radiology interventions have been taken up, the diagnostic radiologists use those medical images taken by X-rays, ultrasound, CAT scan and MRI to diagnose the disease anywhere in the body. The diagnostic radiology deals with variety of regions in the biological system, right from the brain, is known as neuroradiology. Any radiology which is dealing with the toddlers up to the age of, in case of humans, up to the age of 12 years to 14 years. In case of veterinary species, if you talk about the large animals or small animals. In small animals, we include dogs and cats. So, the toddler age or the puppy age is from 0 day to 1 year or 1.5 years in case of canines, and in case of large animals too, it is almost 1 year to 1.5 years, that we call it as heifer age. The radiation or radiology part that deals with the mammary glands or the breast, we call it as breast or mammary imaging. Anything that deals with the cardiovascular system is cardiovascular radiology. Thoracic system or thoracic radiology is also designated as the chest radiology, and radiological images dealing with the abdominal region or gastrointestinal region is referred to as gastrointestinal radiology. The genitourinary system will include the reproductive organs, including the urinary bladder. So that is designated as genitourinary radiology. Musculoskeletal radiology deals with the muscles, ligaments, tendons and bones, is musculoskeletal radiology. Emergency radiology is something that deals with the accidents or some kind of traumatic interventions. Neuroradiology, as we said, anything pertaining to the brain, wherein you can see very well in this picture that that is designating the different parts of the brain, and two hemispheres are very well can be identified in this picture. Two hemisphere or the cerebral hemisphere and different parts of the brain study which is being done by the radiology, we categorize that into neuroradiology. Pediatric radiology, anything that deals with the pups in canines or the heifers in case of large animals. In humans, it is the toddlers. So, the imaging system that segregate themselves as pertaining to the young ones is nothing but a pediatric imaging or the fundamental imaging. The one which deals with the mammary glands or the breast, as you can see this in this mammary gland, is basically a kind of a gland which has different sets of capillaries and arterioles and venules. There are different kind of cells like myoepithelial or epithelium, or at the same time the alveolar, nothing but the fat cells. Okay. And then there is a milk inside. So the gland has a lot of alveolus or alveoli, and there is a continuous journey of exchange of myoepithelial cells to epithelial cells, and this is how everything the system goes on. It is entirely dependent upon different types of hormones, and particularly the milk laid down hormones, and there is a transition when we the entire kind of cell differentiation and transdifferentiation could be very well witnessed in these glands. So there are chances, because when these original cells keeps on changing from one form to the another form, there are chances to have the development of tumor development or the cancer development. So this is the one which we normally entertains and do the mammary gland imaging. And here you can see in these pictures, there are various pictures or plain radiographs of the dogs and cat. There is also an USG has been done. It is in this picture you can see a lot of glands of the mammary system, which is connected with the different lymphatic system. Now the next category here is the chest radiology. As you can see in this picture, the chest radiology or the thoracic cavity radiology deals with the area which encompasses the heart and the related or associated structures. Here you can see the spines of the thorax and the ribs at the same time, which is encapsulating or giving a protection to the heart or the associated structures. So the radiology that deals with the thoracic areas can speak about anything, any kind of damage to the spines, to the ribs, or the flail chest sometimes happens due to the trauma, could also be evidenced by way of chest radiology or the thoracic radiology in case of the radiological science. The next category is the gastrointestinal radiology. Herein, the GI obstructions are very common problems that typically require therapeutic interventions. As you can see in the picture, the mechanical ileus, which is being prominent here, is a physical obstruction of the intestine. You can also see the foreign body are among the most common cause of mechanical obstruction. The severity, which is influenced by completeness, location, and the duration of the obstructions. So as long as the mechanical obstruction is there, it is going to give a lot of stress to the region, and there will be development of thickness of the tissue, and then as a result there will be narrowing down of the lumen, which can create further problems. As the radiograph is showing a segmental dilatation of the region, as you can see here. And in case of dogs, if the diameter is more than 1.6 times the height of the midline of the spine or the L5 vertebrae, is suggestive of the intestinal dilatation. The next category is the genitourinary radiology. As the name suggests, it deals with the genital organs and the urinary system. So in this radiograph, you can very well appreciate that the bladder has been radiographed, and at the same time, in different things here, you can see the different types of stones. These are liths basically, or the stones which are aggregated or got developed in the bladder. There are different features here, the stones, and this is the kind of a bigger stone Uh, and then when we, to be very specific in this radiology, and if you're talking about the stones in the bladder, it is the, we call it as urolithiasis. Okay, anything, the development of the stones, and how these stones actually develops in the animals, it's totally dependent upon the kind of diet they receive. If we talk about the livestocks, the large ruminants or the small ruminants, the kind of fodder they have. So in some fodders, there is a chances that there is a more of oxalate, and so, and these particular constituents becomes the nidus in the formation of the lith. Whereas in case of canines, there are different forms of nidus constituents are present, and since we all know that whatever the diet that the canines actually take is, they have to metabolize it very fast, so that tummy is acidic in nature. As a result, the formation of lith formation chances are quite higher, and it becomes even more higher if the tendency of or if the animals are reluctant to take proper amount of water. So genitourinary radiology deals with the bladder and the genital organs. Musculoskeletal radiology deals with the, as the name suggests, it is the muscles and all the ligaments, tendons which are associated with the joints. So as you can see in this picture, one joint has been depicted. It is a femorotibial joint, or we also call it as a diarthrodial joint. So this is actually showing that there is a formation or the inflammation of the ligaments. So anything that deals with the joints or the bones, muscles, ligaments and tendons falls under this category of musculoskeletal radiology. The last category of the radiology or a diagnostic radiology is emergency radiology. As you, there are some of the pictures has been shown here. There is a emergency happens whenever there is a fracture, either of the head or any region. The human body has been shown here. In similar cases in animals also, the fracture of head could be one of the reason for emergency radiology. There is a pneumothorax as a result of injury to the thoracic region. If there is a, we call it as the thoracic region, if the ribs have been broken, and there is a, because we know that the heart or the lungs is full of air. So if there is a damage to the chest or thoracic region, there is a chances that the air, which is a negative pressure that which is there in the lungs, will get damaged, and we categorize those cases as flail chest. It means the air infiltration starts into the region. There are chances of bullet injuries. It is also similar in case of animals also. The animals or the livestock or the dwellings which are close to the border areas, if there is a trans-border firing, as in case of India and Pakistan usually happens. If you go to the Indo-Pak borders, there are the cases which can be witnessed. The firing happens, and then livestock will also have a bullet injury. So it is the part of the emergency radiology. Then evisceration. Evisceration is can happen in case of animals, in case of humans as well, wherever there is a stab injury. The use of knife or injury with the use of knife could cause the internal organs or the intestines to come out of the body. That is called as evisceration. So that is important because it has a lot of repercussions in the handling of such cases. So impalement is also one reason wherein the emergency radiology is very, very important. The next category of radiology is interventional radiology. It is a subspecialty of radiology that focuses on the diagnosis and the treatment of such patients utilizing minimally invasive interventional techniques, that is a non-surgical procedure. And interventional radiology includes imaging and treatment of blood vessels. We call it as angiography. And if you have to take biopsy, uh, then we use interventional radiology. If there is a cardiac catheterization, then it is important. In angioplasty, it is important. If we have to fix some stents into the heart or the cardiac system, it is required. Laser treatment of varicose veins. Now, there are other terminologies like when we talk about radiology, it is important to also understand what is medical imaging. It is nothing but the techniques used to visualize the inside of the body for clinical analysis and the medical interventions. It's a crucial aspect of modern medicine, enabling the diagnosis, monitoring, and treatment of various conditions. These techniques utilize different technologies, each providing unique information about the body. So that becomes very, very important to know. The nuclear medicine is also one part, which is a specialty of the medical science that utilizes radioactive materials called radiopharmaceuticals to diagnose or to treat or to identify the stage or monitor the response of disease processes. It involves using a small amount of radioactive substances to image and evaluate the function of organs in the tissues to target and destroy the diseased cells. So this is a CT image you can see, and this is a fused with the CT and PET images. We will discuss a little bit more in detail in the next slides. The nuclear medicine modalities in clinical practice, as you can see that there are two different specifications, or PET and S SPECT. These two things are being also used in the nuclear medicine. So that gives even better results as compared to the plain radiography. And SPECT we talk about, it is a single photon emission computed tomography, whereas PET is a positron emission tomography. Other modalities in the radiology are X-ray radiography, which is very common. Fluoroscopy we utilize. We also use the computed tomography. We use magnetic resonance imaging. We use positron emission tomography or single photon emission tomography and ultrasound. X-rays is very common, and it has been used since long. Over the centuries. It is X-ray radiography. We call it as X-ray imaging also. It's a medical technique. It is utilizes to focus on different parts of the internal organs, and these images are called radiograph. It helps the doctors or the veterinarians to treat variety of cases, including fractures, infections, and tumors. What are the procedural follows of the radiology? So when we talk about X-ray radiograph, it is quite understood that X-ray beams are being used, which passes through the different parts of the body, and depending upon the different intensity of the different parts through which it traverses during the process, it gives a kind of a appearance on the radiograph, which is nothing but which is based on the different types of densities. And we make an interpretation based on the different density image will get formed on the radiograph. So this is just an X-ray images or image formation. So with that, we make certain interpretations which helps us to do the diagnosis and the treatment in this field. Some important uses that we normally go with the X-ray radiography are the fractures. It is very important when, say, if there is a fracture of a bone, a femur or a humerus or a tibia, radius ulna, and etc. So fractures could be diagnosed very well with the plain radiograph. Sometimes we can also identify some sort of a bony infections which are prevalent in the bones and the joints with the X-ray radiography. Tumors are very well identified because the density of the tumors, if it is a bigger size, relatively bigger size, can be very well identified in a plain radiograph. Lung conditions can also be diagnosed and monitored with, for example, there are conditions of pneumonia or emphysema which can be very well identified. Foreign body presence can also be very well located. Sometimes it becomes difficult, we make use of certain contrast agent if it is the gastrointestinal tract. The benefits and the risk of X-ray radiography. The benefits are many because it is fast in nature, it is non-invasive, it does not have to go into the body, we do not have to inject anything. It is a painless procedures for the patient, but the risk that comes along with the X-ray is radiation exposure from the X-ray, and there is a risk of developing cancers or other health issues if the patient gets frequently exposed to these radiations. Fluoroscopy is one thing that you can see in this picture. Is it was in use to just check the motion or the motion of an internal organ if some body part has to be observed. And I would give you an example, like if you have seen the animation films is just a moving films, and the animation artists have to make different pictures and in succession, and all of these pictures put together, if it is shown, it appears that something or a person is moving or an action is going on. So fluoroscopy is just similar to that. So there are a number of cassettes which are being fixed while taking an X-ray, and this is being taken at different time point, so that when all of these pictures put together, it appears that the movement of particular organ or particular material. For example, in case of contrast agents, the barium meal studies, where we have to orally give it to the animal, and when it passes from one portion of the thoracic esophagus to the abdominal esophagus and all that, and goes to the intestine. So different point interval, the movement of the barium meal could be monitored by way of fluoroscopy. So it was quite helpful. But nowadays there are many other modalities that has come into practice. For example, CT scan, which has just overcome all these things in the modern era. Ultrasonography that has taken an edge over the fluoroscopy and the plain radiography. So the computed tomography, as I said, it is better than many of the previous modalities. It is known as CT scan or a CAT scan. It is a medical imaging technique that uses X-rays and computer technologies to create a detailed image of the inside of the body. And in this, we can also see the cross sections or different slices. So CT scans are coming in a different capacities of 16 slices, 32 slides, 64 slides, and so on, and 120 slices. So it means the cross-sectional areas of the body parts or the organs can also be very well visualized, which is many folds better than the plain radiography. Here in the CAT scan, as we said, it is X-ray is the source, and there is a detector. There is a narrow beam of X-ray which has been used, detectors which will record the X-ray traverse or when it goes through the body. So computer will process all this data and give a lot of different pictures and of the cross-sectional area or a different forms of slices. So all of these rays, when it passes through the body, there is an image reconstruction. The computer can also stack these slices together to create a three-dimensional image of the body, which is quite useful in the medical and the veterinary science. As I have already said, the CT scan has a lot of benefits. For example, it gives a detailed image to do the better visualization of the internal organs, bones, soft tissues, and the blood, and so on. It helps us to do better diagnosis over the plain radiograph, and the better diagnosis will definitely help us to do the treatment planning and interventional procedures if it has to be done. The CT scan can also be used as a guide for doing an interventional procedures. For example, at one time, if you're doing this, you can take the biopsies, you can also do the vascular interventions. So these are quite helpful. But what is the limitation that comes along with the CAT scan or the computer tomography? It is just one thing is radiation exposure, because though the CT scans involves a small dose of radiation, which is also important concern, because if the person has to uh, mm, undergo the procedure many times, it will be quite harmful, because as I have already discussed with the plain radiograph, the X-ray exposure could bring in cancer and a lot of health issues with different organs. Cost-wise also, it is very expensive, and taking a plain radiograph or over the ultrasound, the CT scan is quite expensive. Sometimes with the contrast radiography, CT scan, we'll also have to use the contrast agents, and the use of contrast agents, which can sometimes cause allergic reaction to the animals or different individuals. The next very important thing is the MRI, magnetic resonance imaging. It is a very powerful diagnostic tool in veterinary medicine, especially for the dogs, which offers the detailed images of the soft tissues like brain and spinal cord. So in case of traumatic injuries to the spinal column, or the paralysis cases, this could be quite useful. It is also useful for identifying conditions of spinal problems, tumors of the brain, and other neurological signs and signatures, musculoskeletal issues, and they may not be which may not be easily identified over the plain radiograph. So, and the beauty of MRI is it is safe, non-invasive, and but in case of animals, it requires general anesthesia, which is important, which may not be so in case of humans. So restraining is one important challenge that comes along with the animal handling. If we talk about the uses of MRI, it is quite important in diagnosing the neurological conditions, which is normally not been done with the plain radiograph. It has not been identified. It will give, the MRI can give a lot of different pictures of the spinal cord or its injuries, or sometimes disc herniations, brain tumors, strokes, and other neurological diseases. It can also assess better the musculoskeletal tissues or issues that is related to the joints, ligament, tears, and other musculoskeletal conditions. It also helps in evaluating the soft tissues injuries, and it gives a better details of these soft tissues, and that helps in identifying different tissues problems such as tumors, inflammations, and other abnormalities. The procedural follow-up in case of MRI in a dog, it is typically the dogs are being anesthetized here, and they are put into a strong magnetic field, as we know that MRI does not use X-rays. So, and since we are here deals with the animals, restraining is one of the biggest challenge. So we do the general anesthesia, and the dog has to be put into this for at least 45 minutes to 2 hours to do the entire follow-up with the MRI. The drawback and limitations of MRI is one in case of animals is that we have to anesthetize. So anesthesia itself is the biggest challenge, and sometimes the animals have a different behavior with different anesthetic regimens. The cost wise also, if we see, it is quite expensive. Every dog owner would not be able to afford it. The limitations further is MRI may not be helpful for visualizing the bone fractures or certain internal organ issues as compared to the X-rays or the CT scans. If we talk about the benefits, it gives high quality images, it is non-invasive and painless, and since it does not deal with an X-ray, there is no exposure of radiations, and it is, of course, it is a advanced form of diagnostic tool. So MRI could, as we, the indications of the MRI in case of dog, it can be useful in the neurological problems like cases of seizures or paralysis, and to identify the brain tumors or other neurological abnormalities, musculoskeletal tissues, or issues like joint pain or suspected ligament tears could also be useful. MRI is useful in such cases. And if a veterinarian suspects other soft tissue problem, they may not be visible on the X-rays or the CT scan, could be very well be taken up for MRI diagnosis. The other forms of radiology is the PET, the positron emission tomography. These are also a kind of scans, and often combined with CT scans. These are used to evaluate the organ wellness and the tissues that are functioning by measuring the metabolic activity. So one of the important thing which is being used here is the radioactive tracer. We call it as FDG, which actually accumulates at one particular region of the organ where there is a high metabolic activity is going on. And where the high metabolic activity will go on, it's the very common example is the tumor. The activity will be very high, and this FDG will get accumulated, and the traces which gets collected in those areas will have an increased appearance on the such scans. So CT provides the detail of anatomical image, whereas the PET will use the FDG to show that the metabolic activity at particular point is quite high. So it could be suspected as tumors or something like that. So the PET scan and the CT scans are combined sometimes together to seek its benefit. So when these are combined together, the detection is quite fast and it is accurate, and it is better to have, all of these accurate diagnosis will definitely improve the treatment or the treatment planning. The specs that we use, this is a single photon emission computed tomography. This medical imaging uses the radioactive tracer to create the 3D image of the body organs, showing how well they are functioning. It helps the doctors to diagnose variety of the conditions, especially of the heart problems, brain disorders, and the bone diseases. Uses of the specs, if we have to discuss, it can be used on heart, it can be used on brain, and the bone disorders, and other applications can also be used on thyroid diseases detection, and some different types of cancers which are not usually been very well giving a proper details with other modalities in radiology. If we have to talk about the benefit, since it gives a better detailed information about the organ, and it can be more sensitive than other imaging techniques in detection of the disease condition. The risk that is associated with this scan or the SPECT is that exposure to radiation from the radioactive traces, that FDG. So the amount of radiation is generally considered low, but there are chances that the FDG exposure could also bring in a lot of different health hazard with the use of SPECT. And when these animals are actually the radiology being done, as you can see in this picture, the positioning is very, very important. Say, for example, positioning is very, very important. So terminology wise, well, what either you're doing an X-rays, you're doing an computed tomography, PET or CT together, or if you're doing a SPECT, whatever, MRI. So positioning, so what are the results that you get? The positioning is very, very important in terms of animals. So whatever anything that is over here on the area of the head, we call it as a rostral, and below the chin or in the region is the ventral region. Anything that is towards the head region is, we put it as cranial, and the portion of the body on the dorsal side towards the tail is caudal, and anything above, in case of forelimbs and the hind limbs, you can just see the forelimbs above the carpus or the carpal joints, above the limb area is weak, and same is in case of the Same is in the case of the hind limbs. Carpus is caudal, and the posterior aspect above the tarsus is the caudal. And one important thing is important to note is the plantar area, palmar area and the plantar area. So, in the cranial system, portion below the carpus is the planta, and the portion below the tarsus is plantar. This is palmar and this is plantar. So, this becomes very, very important to understand. Very quickly, we will just brief the use of the radiography in veterinary sciences. It is very important tool for diagnosis, and it is important to monitor the fracture or the fracture repair. It is important in the treatment procedures, screening of animals for morphological evaluation. It is important, and determining the age of animals. The radiography is important. To examine the postmortem material, it is important. For non-destructive examination or archaeological species, it is important. And for the teaching aid, especially for anatomy, it is important. For veterinary research, osteomedullary procedures and bone healing procedures is quite useful. So with this, I must thank all of you for your patient listening. Thank you so much.